Applying the PICO single-use negative pressure wound therapy system to a diabetic foot ulcer. Introduction. The PICO portfolio offers unique single-use negative pressure wound therapy that helps improve both wound closure and surgical site complication rates. The PICO portfolio manages low to moderate levels of exudate while providing compression-like therapy to the wound or incision, wound margin, and peri-wound area. It's canister-free, portable, and splash-proof, which can help improve patient mobility and increase satisfaction rates. The PICO system is the first FDA-cleared device to provide 7 and 14 days of pump wear time for a wide range of indications, including acute, chronic, and traumatic wounds, subacute and dehisced wounds, closed surgical incisions, flaps and grafts, and partial thickness burns. PICO portfolio dressings have a proprietary 4-layer structure for optimal exudate management in both open wounds and closed surgical incisions, with our patented airlock technology layer that helps distribute negative pressure evenly across the entire surface area of the dressing. The PICO system meets a variety of needs, with options that offer pump duration of up to 14 days, various dressing sizes, and the ability to treat 2 wounds or incisions simultaneously. Components. Now let's take a closer look at the PICO kit's sterile components. Unlike other systems, everything you need is included in the kit, so you never have to search for supplies when you're ready to apply. Application overview. PICO 7 is engineered for an easy, accurate application. Remember, PICO dressing should only be applied, changed, or removed by a healthcare professional. First, let's review some important information about fit fillers and placement. PICO 7 and 14 can be used on closed incisions or wounds up to 4.5 centimeters deep, with low to moderate exudate levels. This means approximately 300 milliliters of fluid over the course of a week. PICO dressing should be used on closed incisions or wounds that fit comfortably within the area of the pad. Diabetic foot ulcer application. Now let's see how PICO 7 is applied to a diabetic foot ulcer. First, choose the correct dressing size for the wound. Clean and prepare the wound according to local protocol. If applying to fragile skin, a skin protectant such as no-sting skin prep should be used on areas of skin where fixation strips are to be applied. Apply wound filler if needed. The PICO system is compatible with standard gauze and foam fillers used in traditional negative pressure wound therapy where this is clinically appropriate. On infected wounds or wounds at risk of infection, Acticoat Flex, silver-coated antimicrobial dressings may be used under PICO. Acticoat Flex should be moistened according to local clinical protocol prior to application. Using a sterile technique, peel off the first backing plastic piece and place the dressing centrally over the wound. The soft port should be placed on intact skin and should not extend over the wound. Remove the remaining backing plastic piece and smooth the dressing around the wound to prevent creasing. The silicone border, but not the dressing, can be cut to help create a better fit between toes and achieve a secure seal. You may also choose to apply Renesis gel patches to help achieve or maintain a seal. When working in awkward areas, you can use a fixation strip to hold the dressing in place before starting the application of negative pressure. Once the seal is established, you can apply the remaining fixation strips. Once the dressing is in place, insert the batteries into the pump as shown. Once the batteries are installed, all 4 indicators should illuminate for 3 seconds. Replace the cover and attach the included belt clip to the pump. Join the pump to the dressing by twisting together the tubing connectors. You can connect the soft port tubes directly to the pump or use the included extension tubes. If you don't need the extensions at this point, save them for dressing changes. Press the orange button to start the application of negative pressure. The green OK indicator and the orange leak indicator will start flashing together. This tells you that the pump is working to establish negative pressure, while a buzzing sound will tell you that it is working to achieve a seal. Patients may feel a slight pulling or drawing sensation. Depending on the size of the wound, the pump can take up to 65 seconds to reach the intended pressure. Once therapy is established, only the OK indicator will remain flashing. The dressing will compress and should be firm to the touch with a raisin-like appearance. If the pump is unable to establish negative pressure, only the orange leak indicator will remain flashing. Follow the troubleshooting instructions for eliminating leaks and blockages. Apply the fixation strips all the way around the dressing so they overlap the border by approximately 1 centimeter. Remove the printed top layer after you've applied each strip. This system is designed to allow patients to continue with their daily activities as appropriate. For patients with diabetic foot ulcers, the PICO system should be used in conjunction with appropriate offloading interventions. Change dressings in line with standard wound care guidelines, typically every 7 days without a filler and 2 to 3 times per week with a filler. With a canister-free, patient-friendly design, the PICO system offers a unique solution for single-use negative pressure wound therapy. Experience the power, convenience, and versatility of the entire PICO portfolio system.